What is RSV?
RSV is a virus which causes a lung disease called bronchiolitis.
And what group is more likely to be exposed to it to get into trouble?
Well, all children get exposed to RSV virus, and in fact all children get infected with RSV virus. But about 25% of children who do get infected get a much more serious disease called bronchiolitis, where they have wheezing, difficulty breathing, and a real risk for requiring hospitalization. Children who are at the highest risk of having this severe form of RSV infection are children who have been premature or children who have some other underlying lung problem even before they are infected by the virus.
Is there any particular time of year where it's more apt to be RSV around?
Well, RSV season starts for the most part through the months of October, November, continues straight through the winter months, and tends to get less common as we get into the spring months of April and May.
If someone was from South America, would it be the same rule or different rules down there?
It seems like in South America the months are reversed. So where we are in our RSV season is when they are not, and vice versa.
Europe would follow what we go through?
Europe follows our pattern. Australia follows South America's pattern. And so it seems to be a northern hemisphere, southern hemisphere phenomenon.
Is there an occasional case found in the summer?
You can always see a sporadic case, and when we do surveillance in this area, you'll pick up cases here and there through other times of the year, but the 6 months fall through winter and early spring is the most common time.
There's a passive vaccine available for RSV?
There's a new form of treatment available called Synagis. This is a type of injection, not truly a vaccine, but a modifying antibody which is given to children on a once-a-month basis. By giving this vaccine, this injection, on a once-a-month basis to children, it would provide them with extra protection so that if they do get infected by the virus, it would not be the most severe form of the infection.
There's also some indications there could be a new improved version of this vaccine coming up.
Well, there is a newer, more potent form of this injection which is still in development and clinical trials. I'm expecting that those clinical trials should be completed over the next year or two, and at that point the data gets submitted to the FDA for review.
It's a very expensive drug to give, so the drug companies have put some restrictions what they'll cover for. What groups would they usually cover this vaccine or drug for?
This vaccine is quite expensive, and estimates are anywhere from $500 to $1,000 per dose, and the doses are given once a month. Because of its expense, the drug companies, I should say the insurance companies, not the drug company, but the insurance companies restrict the use of this vaccine to those that are in the highest risk population. In fact, restricting that use at this time is also still supported by the American Academy of Pediatrics. That high-risk group includes children who are born premature. Children born at less than 32 weeks certainly are at the highest risk, and children born between 32 and 36 weeks of gestation are also considered at risk if they have another risk factor, such as other children in school bringing the vaccine home to them, exposure to environmental pollutants, or some other respiratory abnormality.
What about a full-term baby born with, say, cystic fibrosis? Would that be a required condition?
The studies looking at cystic fibrosis children are still ongoing, and the jury is out. My personal opinion is I'd like to see those children covered just because they do have lung disease, although their lung disease usually isn't a problem in the newborn period. The other group of children that clearly are at high risk are children with congenital heart disease. Any child born with a congenital heart disease is at much higher risk for having a very severe form of RSV infection, and those children are clearly indicated to get this injection as a preventive of that form of disease.
Do all of them get coverage through insurance, or there is concerns that they may not get covered?
Well, for the most part, the insurance companies do cover all those other children. Some insurance companies are more cooperative in providing that coverage than others, but we're able to provide that coverage through our program and the cooperation with the company.
Well, you mentioned a program. You actually have a program where you help the pediatricians and the families out by trying to get the vaccine and have people come to the home as not getting the kid exposed in the office. Is that true?
Yes, we do. We do have an extensive program for providing Synagis to children in a variety of settings. We have 2 outpatient sites where we provide Synagis, and we even provide the ability to work with the insurance companies so that if there's any difficulties, we're able to get through a lot of the red tape and get the injection covered. In addition to that, once children are given their first dose on our site, we're able to set up home care where visiting nurses are able to actually come into the home and provide the injection in the home rather than the child having to come to our clinical site where they may be exposed to other children who are sick. That type of coverage isn't allowed by every insurance company, but some insurance companies do allow it, and we worked with a great deal of zeal to try to provide that coverage for our children.
Since Synagis has been around, the number of deaths have gone down, hospitalizations have gone down. Is that true?
It's absolutely true.
So
there's no question that Synagis is a very effective vaccine. We've seen the number of hospitalizations, intensive care unit admissions, children being placed on respirator, and death rates drop in this high-risk population who are given Synagis as a preventive medication.
Because if a premature gets admitted with RSV, it could be life-threatening. They could be in the hospitals for several weeks, and the cost of that would be in sometimes $100,000 or more. Is that true?
Oh, absolutely. The cost of caring for a sick child like that can go up and up and up, and is more than offset by the cost of the medication.
Thank you.